Nurses of Reddit, what's your worst work-related story? Had a nice older gentleman patient who was tachycardic, but all his labs were normal. He seemed like he took fairly good care of himself, was a little disheveled, but he dressed nice, and had nice shoes. We initially couldn't find anything wrong with him, but he had a peculiar odor to him that seasoned nurses would get suspicious of. I asked him if he had any infections on his body that he knew of, and he said no, but I wanted to do a thorough check, so we took off all his clothes, and he was fine, until I got down to his feet. He was wearing an old pair of socks, and as I peeled them down, literally the skin around his foot came off with the sock. I was essentially degloving his foot. It was so vile, I couldn't even get down more than a couple inches. It was raw flesh under those socks. The wound odor was so strong, I knew then that his feet were the source. He probably hadn't changed his socks in several months. He ended up being admitted and given lots of antibiotics and wound care. The memory of pulling down his socks will haunt me forever. Mental health nurse here. I witnessed this, but it didn't happen to me. One day on shift I responded to a duress alarm on another ward. One nurse from each ward responds to duress from any ward. A female patient on a psychiatric intensive care unit had become violent and could not be de-escalated. It was decided that physical restraint and intramuscular medication would be needed to settle her down. Anyway, as the team of 5 nurses approached her, she was standing there with her legs apart and shouting at us. Just as we stepped into her space to initiate the restraint, she stuck her fingers into her vagina. She was menstruating at the time and managed to stick them into the mouth of one of the female nurses doing the restraint. The patient was extremely amused. Nurse vomited after the restraint and had to leave for the day. That's just one of the really bizarre moments I have experienced since working as a mental health nurse. Not a nurse, but a nursing assistant. I was pulled to the ER one night to help with a patient being brought in by ambulance. We're a small hospital with only one nurse. Anyway, we knew this patient was going to be a mess after hearing from the medics that she had been on her floor for weeks. Her husband, who didn't live with her, had been bringing her food, but otherwise left her laying there. The medics had to literally scrape her off the floor with the help of a shovel. She was a rather large lady, and you can't imagine the sores on her backside from laying there in her own filth for a month. We of course started cleaning her up right away, and it shocked me all the trash I pulled out of her folds. She even had a pop bottle lid in one fold that had carved a wound in her skin. I have a few that aren't the worst out there, but they are still good times. A schizophrenic homeless man told me how he had to smoke all of the crack before the crack mamas could, so that he can save the crack mamas' babies. Then there was the old man that would poop himself, dig his fingers in his ass, then proceed to put his poopy fingers in his mouth and up his nose. Lastly, was the obese woman that had horrible lymphedema, which made it hard for her to walk, so instead of getting up to the bathroom or commode she would ask for a towel to stuff between her legs and piss all over herself. The smell of that woman's inner legs cannot be described with words. Tough to choose honestly. A couple years ago I took care of a long-haul trucker who developed a wound on the underside of his ballsack. The vibration of the truck seat wore away at his scrotum, and he developed an infected ulcer. As you can imagine, this makes for a very fragile situation. One day we were helping him out of bed when his scrotum ruptured wide open, pus splattered everywhere, and his testicles flopped out. A bad day for all involved. Also worth a mention, I've seen multiple patients come in with maggots in their festering wounds. How does a maggot infestation in your body go unnoticed? And for fun, the one time I had a patient fresh out of open heart surgery try to escape through the toilet. He was having DTs and withdrawals from a variety of street drugs. Found him knee deep in the toilet trying to swim out because he loves the smack. 4 security guards couldn't hold him, even with chest tubes, mid-sternal incision, Foley, the whole works. Don't do drugs, kids, but if you do, please tell us which ones. Posting one more that I just remembered. 20-year-old patient in for a motorcycle accident sans helmet. Kid survived but was never going to be not a vegetable living off of 15 different tubes ever again. He literally lost too much brain tissue. That kinda stuff is par for the course in a level 1 trauma center. What was hard was watching his parents stay in his room in shifts, documenting every little twitch and spasm, and reporting on to us as a sign that he was waking up, only to have to be gently told, after assessing of course, that it's just spasms with no conscious thought. They would also happily keep telling us about the welcome home party they had planned for him, and making jokes that they are never letting him buy a bike again. One day they started visiting less and less, and eventually stopped coming at all. Finally, they made him a DNR. He was their only child. Damn. Wear helmets, people. Please. Too many to choose from, so I'll just go with a recent one. Was doing wound care on a diabetic man, who took zero care of himself. It was a foot ulcer with necrotic tissue and gangrene. Awesome. As I was pulling the old dressing off, I felt a subtle crunch. I looked and saw that yep, the dressing pulled one of the man's necrotic toes completely off with it. The hell of it is. He just sighed and said not again. Turns out just a few months ago, his other foot was at that level of ulceration, and one of those toes came off when he went to put shoes on. How he failed to notice the smell and severity, although tbh he was morbidly obese and couldn't even see his feet, is a mystery. I'm so glad I'm a mechanic. Crunchy noises will still make your heart sink though. Same with computers. Turn a PC on and hear a kind of crunching noise. Well, may as well call the customer and tell them their data is fudged. At least I don't have to tell my customer that their effing body parts are falling off. Won't share the most common one as it could very easily be used to identify me and the patients. But I've seen some nasty stuff. My first night shift I had a guy pee on my face and shoulder. He almost got it on my mouth and lips, but I saw it coming and turned. He was confused, unsteady, and he climbed out of bed actively urinating all over the floor. I grabbed a urinal and held him up and got him pointed in the urinal. Everything is going great until he reaches down and grabs it, pointing it up and out of the urinal, directly at my face. Patient would get a blood transfusion about once a month. The wound smelled like week-old roadkill and you could smell it all the way down the hallway. While reinforcing her wound dressings one night, we unwrapped an ace bandage that was holding an abdominal pad in place to catch the drainage that was soaking through the primary wound dressing. When we pulled the ace bandage and abdominal pad off, a fly came flying out of the wound dressing. Both myself and the nurse saw it, and the nurse let out an eekk. Patient asked what happened. Fellow nurse is barely holding it together, and I tell the patient a fly came out of the dressing. Patient replies, oh yeah, that happens sometimes. Medical maggots are used to clean wounds, but medical maggots cannot become actual flies. They try to pupate from larvae to fly, but have been modified to prevent them from being able to. This was definitely not a medical maggot, because we never used them on her wound as it was not a candidate for maggot therapy. Lady was not homeless, and would be considered middle class. Anything involving maggots, unless we put them there on purpose. Had a drive and dump that got admitted, lady of the night, based on clothing choices, had roaches, just 3, but any is too many, crawling out of her nether region. God love my tech, she just stomped on them, and made fun of me. Got my arm stuck between a patient's butt cheeks while inserting a fecal management system for C. diff management. I weighed in at about 115 pounds at the time, he was 400 plus. He clenched and was screaming at me to get out of his ass. Happened years ago and still gets brought up. Had a patient who had a sacral decute that was huge. My head would have fit in the hole. Mo hyperbole. The dressing change was like trying to pull a deep dish extra cheese pizza off someone's caved in lower back. She had so much slough. She lived through that for months. Plus she was demented, deaf, blind, on dialysis, had ACAs to her hips, and had billet amputations to her elbows. Constantly begged Jesus to let her die. Her daughter had POA and just wouldn't change the code status. And finally, not a nurse, but a medical assistant. Was my first day on the job at an urgent care and was asked to assist with an abscess drainage. I said sure. Walk into the room. The patient is laying on the bed with her legs in stirrups. NBD. Just assumed the abscess was on her inner thigh maybe. Wrong. She had two abscesses, one on each side of her labia, each about the size of dates. So the doctor cuts into the first one. Now usually with abscesses, you cut it open and blood and pus drains out. This one though, she cut it open and a green fluid the consistency of molasses started to leak out. The smell was so terrible, but I could not react as the patient could see my face and I did not want to embarrass her anymore, so then she already was having vaginal abscesses drained and all. When the draining slowed down, the doctor literally started pulling on it, basically roping it out of the wound. After packing the drained abscesses I had to bandage her up. After the patient left I was congratulated by my coworkers for keeping composure, especially for it having been the first procedure on my first day. I loved that job and miss it every day. I don't really miss the craziness that made my job interesting and fun. I can only imagine how painful those abscesses had to have been, and how much better she felt after the doctor got them out. Don't forget, like, share, subscribe for daily Reddit madness.